Okay, hello, everybody. I'm Susan Henderson from the Disability Rights Education and Defense Fund. And this week on our question and answers on the COVID-19 vaccine, we have the world famous Judy Heumann. Judy has been a lifelong disability activist, and I really mean lifelong. She is the founder of Disabled in Action in 1970, a really early activist organization in New York City. Judy came out to Berkeley, where DREDF is located, in 1973 as one of the co-founders of the Berkeley Center for Independent Living, and also served as its deputy director for many years. She was one of the leaders at the very famous 1977 504 sit-ins in San Francisco and across the country. And she was also one of the co-founders of the World Institute on Disability. After leaving WID, World Institute, she went on to serve in the Clinton and Obama administrations, and also the World Bank. Now Judy is an author of 2 books, and very proud to say she's on the DREDF board. So Judy, welcome.
So great to be with you. I'm sorry that we're only able to tape this. We're not going to actually be touching people in a big room, but I want to thank you for asking me to participate in this great program that DREDF is working on to help bring the message of the importance of COVID and disabled people and others getting vaccinated. So, I think I had polio in 1949, and the polio vaccine did not come out till 1955. I get emotional around this discussion because the vaccine that I didn't get because it wasn't out yet resulted in my having polio. And I'm very proud to be a disabled person. But the reality is, if the polio vaccine would have been out before 1949, I wouldn't be here today. And I think we really need, as we're looking at this most serious discussion about the numbers of people who have not yet been vaccinated, we need to get into a discussion which also talks about, yes, many people are dying who have had COVID, more than 130,000 having died in nursing homes alone. But we're also looking at the long-term effects for some people who get COVID and have disabilities. Like polio, many people died, and then other people have the long-term effect of polio. And it really takes quite a number of years to really get a better understanding of who are the people who are going to have the long-term effect of COVID, and what are their disabilities going to look like, and what are we going to need to do to help ensure that those people who in fact have disabilities as a result of COVID are getting the services they need. So it's really a complicated discussion for me, Susan, because I feel like you that disability pride is so very important, but obviously vaccines that can prevent things like measles and polio and other healthcare conditions and COVID are something that I believe are very important.
They are, and I'm like you, Judy. I was born in the late 50s, and the vaccine, the polio vaccine, became available soon after I was born. And I remember going to the school, sort of our mass vaccination sites, to get actually the polio sugar cube at that time, and then later getting a polio vaccine booster at my pediatrician's office. And I just wish that was true for all children right now with COVID. And I can't wait until that day when children can be getting vaccinated against COVID. So because if we can prevent, not only does it prevent COVID, but it also means that people with disabilities and people without disabilities won't get the disease and won't exacerbate existing conditions that they already have, because we know that people with pre-existing conditions are at more risk for severe COVID than those without. So anyway, do you want to go ahead and share a little bit with us about what your experience during the pandemic has been?
Sure. So my husband, Jorge Pineda, also has a disability, and he had some other healthcare conditions going on at the beginning of COVID. And because not only did I have polio, but there are three different types of polio, and I had all three. One of them impacts my breathing. And so I was, of course, taking a lot of precautions not to get COVID because I'm 73 years old. I was 72 when the pandemic struck, but I know that my breathing is not normal. So, coupled with the fact that Andrenev is a great example of the types of practices that states were trying to put into place to make it more difficult for those of us with disabilities, should we contract the virus, to be able to get appropriate health care. I was, of course, very concerned that if in fact I did contract COVID, that it would be more difficult for me to be able to get life supports, for example, breathing equipment, should I need it. So I think, in 2020, there were many things going on in my mind. Obviously, one, because I can't do things like get in and out of bed myself, get dressed and undressed myself, cook, go to the bathroom. I need assistance. And we have two people who live in our home on a regular basis who assist me. And because my husband had recently gotten ill, we were also needing assistance for him. And so we had quite a number of people who were coming in and out of our house on a regular basis. And at that point, there was no vaccination. And so I was really looking for a number of things. One, I was very proud to be on the board of DREDF because DREDF was one of the leading groups and is one of the leading organizations that really has been fighting for the rights of disabled people, COVID becoming a preeminent issue that they were working on. So on the one hand, I was feeling that DREDF and other organizations were really analyzing what was coming out from the federal government policies at the state level and jumping in there and trying to work right away to either avert those policies from coming out or getting them retracted. DREDF was working with many other organizations like the National Council on Independent Living and organizations in California and other parts of the country to really allow people to see that my concern was the concern of hundreds of thousands of other disabled individuals. And like most people in the United States, we're not used to being able to jump in and look at the policies that are being developed and make statements about why they're good or bad. So again, that's why advocacy groups like DREDF were so important because of their knowledge and expertise. And because the organization is run by disabled people, many of us also had the same concerns. So it was when the vaccine was finally looking like it was going to come out that many of us were relieved that something was coming out, but concerned about how we would gain access to it. And quite frankly, there were comments that were being made about how there would be people who would be reluctant to get the vaccine. And I really was of the mind that that really couldn't be true, because at the very end, I really felt that people want to protect their families. Even if they don't really care about other people, they want to protect themselves and their families. And that's, I think, a lot of what we're talking about. Now that we've been able to get bad policies and practices not occurring as they would have occurred in 2020, now we've got the vaccines out. And now we have people who are getting the vaccine but way too many people who are not. And what concerns me, again, as a disabled person, as an activist, is the people who are not getting the shot and how their failure to become vaccinated, have their families vaccinated, is not just an issue for them, but because of the variant, because of the changing of the virus, those people who are not vaccinated are at greater risk. Now, what we are seeing is that for those of us who have had the vaccine, and I had Moderna, that the vaccine is really holding up strongly. But it does concern me, even as a vaccinated person, that we could be looking at having to go into a more restricted living environment again because of others who have not been vaccinated. So that really today is my biggest concern. I feel like we've been removing many of the barriers, and I'm sure there are still barriers that are out there for some people to actually get the vaccine. But I think those barriers are becoming fewer and fewer. And right now, the biggest barrier I think that we're really needing to do is to be speaking with people who have not yet been vaccinated and really encourage them for themselves and for their family members that the information is out there, that we know statistically in states like Arkansas and pockets in California where people have not been vaccinated, that the variant is hitting, that the numbers of people getting the virus is increasing. And death is obviously something that I'm concerned about, and I presume many people are also concerned about. But truthfully, I am concerned about the millions of people who will, in fact, not be vaccinated, contract the virus, and then have long-term impact from the virus, or what we would call disabilities, and how that will affect people's ability in some cases to work. It will increase healthcare disparities and things that many people would prefer to avoid. And a vaccination can really help prevent so many things.
Thank you, Judy. That's so true. I saw a message the other day about, on social media, someone had said, we need to be getting more information about disability rights out to the people who have had COVID and may have lingering symptoms or permanent symptoms, permanent disabilities from it. But one of the things that I have learned over the years is that when somebody newly acquires a disability, it takes them a while to many people a while to accept that disability or to understand that they are disabled, in fact. Do you have any advice for folks who are or who do have like the long COVID, who might be watching? What would you tell them?
Well, I think, again, I look at polio, and I'm not saying that polio and COVID are parallel, but there are a lot of similarities. And by that, I mean, there were people who had polio who years down the road started having an effect from the polio, where maybe they didn't even know they had it, or they had it, it had only limited impact, where down the road they began to have various problems, walking, muscular problems. And then, of course, there were people who immediately had the impact of the virus, some mild, to people who, like Ed Roberts, basically was in an iron lung in the evening and used a portable respirator during the day. Now, again, I want to say that we are able to live very high quality lives with disabilities. So, should you, for whatever reason, have COVID, contract COVID because you haven't gotten the vaccine, it's important, as Susan was saying, to stop looking at disability as something negative, because it will become a part of your reality. And if in fact you contract COVID or have had COVID and are having disparities, various forms of disabilities, I think there are a couple things that you should do. You should call the Center for Independent Living in your community, because there are services that are available to you that you may not be hearing about. And the Centers for Independent Living, which you could look up, and maybe at the end of this, Susan can put some information up through Jetta about the Independent Living Resource Utilization Project, which will give you the name of every center in the United States. That would be one thing I would suggest. I also would be speaking to my doctors or healthcare workers or PTs or OTs, physical therapists or occupational therapists or a speech therapist that you may be involved with, and tell them that beyond the therapies that you may be getting, you want to be able to look at what you need to do to be able to live your life as much as possible like the one you had before. And meeting other people. I mean, I think it probably would be very valuable, and this may happen at some point, where survivors of COVID who have long-term disabilities also find a way of getting together and talking to each other and talking more about the effect of COVID on your lives. That certainly is what happened with polio. Groups like the Post Polio Health International, which was created to allow polios to get together and speak with each other to learn about the variety of disabilities or degrees of disability that people have. But I think one important part of this program today is to really implore people. If you have friends who are reluctant to get the vaccine, speak with them, talk with them, help them understand that getting the vaccine is not only important for them, but for other people around them, and allow them to understand that there is a possibility that if they do acquire COVID, that they will have long-term disabilities. And, I am not judging people in a negative way, but I am really saying we have enough vaccine. And I do work internationally. And as someone said the other day, in the United States, we have people who are eligible and can get the vaccine and are choosing not to. And there are people all over Africa, for example, who don't have the choice as to whether or not they will take the vaccine. They want to take the vaccine, but they don't have vaccine to take. So we should look really at the fact that there are many people in this country who are privileged to be able to get this vaccine, and basically every place for free. Where in other countries where people really want it because they know the impact of disease, are unable to get it. So whatever your politics are, love yourself, love your family, and respect yourself and your family enough that you look around and see the millions of us who have had the vaccine, who are not having adverse serious effects. And really, after I had my second shot, I felt so much freer to be able to really go out and do things. And now it really, as I said earlier, is a real concern to me that people's failure to get the vaccine is going to really potentially result in needing to go back to more restricted living environments, which I, like you, would prefer not to have to do.
Thank you so much, Judy. I actually think that that's a good place to end. Get your vaccine, respect yourself, love yourself, your family, and the people around you.
I just want to thank you, Susan and Dretta, for your ongoing leadership. I think it's so important. You deal with difficult topics in a forthright way, and I appreciate it.
We appreciate you. Thank you. And thank you, Tammy, for interpreting. Bye, everybody.
Bye, Tammy.